Good afternoon, everyone. On behalf of the Lupus Foundation of Minnesota, I want to thank everyone for joining us today. My name is Sandy Parnell, and I'm the Director of Education for Lupus Foundation of Minnesota. Welcome to this webinar titled Lupus Fatigue, Fact and Fiction. Our presenter today is Brenda Free. Brenda joined the Occupational Science Occupational Therapy Department at St. Catherine University in 2007 after 24 years of clinical practice as an occupational therapist. She is an assistant professor in the Master of Arts in Occupational Therapy program responsible for teaching classes such as clinical kinesiology, biomechanical concepts, research, and master's project courses. Her clinical background includes experience with adult rehabilitation, hand therapy, work hardening, clinic administration, and supervision. Her research interest is community-based educational programming for individuals living with chronic disease. She's currently involved in research to determine the effectiveness of fatigue management and physical activity programming for those living with lupus. Before Brenda begins her presentation, I want to talk a little bit about the functionality of the webinar system. At this time, I would like you to turn off your webcam function if it's on. Turn on your mute. The only voices you'll hear during this webinar will be my own and Brenda's. Your audio will be heard through your tablet or computer. And we really invite you to ask questions during the presentation. You can type in the question in the sidebar. I will see it, no one else, and then I'll ask Brenda during or at the end of the presentation your questions so you can hear some responses. We're recording today's session for future audiences, and the session will be archived on our website. And at the conclusion of the webinar, a survey will arrive in your email, and we hope you take a few minutes to complete it. Thank you very much, and without further delay, welcome, Brenda. The floor is yours.
Thank you, Sandy. This webinar will focus on the concept of fatigue management through the exploration of the physiological base underlying symptoms of lupus fatigue. During the presentation, I will describe the impact of lupus on fatigue levels and identify treatable causes of secondary fatigue and analyze the evidence supporting fatigue management strategies. I'm going to have you go back a slide, Sandy. Thank you. As Sandy mentioned, my heart is both in the clinical and the academic world. I work as a casual hand therapist for Fairview Hand Center and as a professor at St. Catherine University. So you might wonder, how I came to look at lupus, and this was actually out of my clinical experience. My clinical experience working with people with lupus led me to believe that some of the interventions that we do are very helpful for people with lupus. And yet when I looked at the literature, I found a huge gap. There really was no proven intervention that I found that was really successful. Yet I knew in the clinic when I assessed clients, they came in with quite a bit of impairment, especially in daily living skills. And when I applied basic strategies that helped them stabilize their joints, helped them manage their work and home environments, they reported significant improvement. So it was at that point that I kind of had a voice in my head, or a spiritual calling, if you would say, that said, you should really look into this a little bit more. And I continue to follow that heart and continue to look at it more and more. And the more I look at it, the more I think there's more research that needs to be done, but definitely some things that really can help that aren't being currently implemented on a regular basis. Now, when you look at this slide, you may notice that I have two cats on here. Personally, I like cats. And you may have noticed that cats are kind of a popular social media trend. Well, I found that on clip art, there's a lot of cute pictures of kind of tired-looking cats, and they just seem to fit this presentation, so I've used them here. The objectives of this session are to help understand the process of lupus and impact on fatigue level, determine the difference between primary and secondary fatigue, identify treatable causes of secondary fatigue, and analyze the evidence base supporting fatigue management strategies. Now, I titled this Fact or Fiction. So I want you to think about some of these questions as I go through, and I'll help sponsor the answer with some of the evidence that's out there. So my first question is, fact or fiction? Fatigue is something, lupus fatigue is something different. So what do you think? Well, most research would say yes, it is something different. The term fatigue is commonly used to define or reference exhaustion from overuse, labor, or stress. Fatigue can be mental, limiting cognitive function, or physical, limiting physical capacity. Lupus fatigue is very different from this definition in that it is often not associated with any overuse or other cause, but yet results in extreme mental and physical exhaustion. It is chronic, occurring more frequently and more severe than other types of fatigue. It can come on quickly, and it can affect physical, emotional, and social functioning. And what's really important here is people with LSE report that it really affects their daily life and what they do. Since we really do not have a term in our language that speaks to this level of fatigue, I have named it for this presentation X fatigue. Like X is an unknown factor, but yet there's still fatigue, or an extreme, like the case of extreme fatigue. I think sometimes the way that we speak about being tired and the way that we use fatigue when we're talking about lupus fatigue doesn't really help us communicate what we really mean. Some of the common terminology that we think about when we talk about ideas related to fatigue are malaise. Malaise is a feeling that's often associated of when you have a flu or illness, a lack of health that's accompanying the onset of an illness, but returns when you're feeling better. Tired.
Brenda, we have lost you.
Yes, is a term we often use when we are feeling like we have exerted a lot of energy and now we're tired.
Brenda,
oh, really?
You're coming in and out a little bit.
You don't have me anymore? Yes?
Now I have you. Are you? Okay, keep going. Thank you.
Okay.
Mm-hmm.
I can hear you totally.
Good.
Oh, maybe I turned my head, so
Yes,
that might have been why.
That must be what's happening. Thank you.
What's interesting about tiredness is...
Oops.
Okay, is this better now?
You just went out a second ago, but let's try it again.
Okay. So what's interesting about the term tiredness is that that's often what people with LSE use to describe their fatigue. But this may be misunderstood in that the normal tiredness would be improved by rest, but in lupus, tiredness is not improved by rest. The term fatigue, as I mentioned earlier, is weariness from exhaustion or labor, a lot of physical exertion. And when we think about this level of fatigue, we also think that if we rest, we'll feel better. But in lupus fatigue, that is not necessarily true. Can you hear me? Okay.
Yes, thank you.
Okay. So this type of X fatigue is a different form of fatigue. It may be frustrating and difficult for others to understand. Those with lupus often describe their fatigue as overwhelming, unpredictable, and dominating, controlling life, not necessarily related to physical or mental exertion. The nature of SLE-related fatigue, it has been described as constant with peaks, unbeatable, impossible to resist or control, and incomprehensible to those who have not experienced it. A lot of this work comes out of qualitative focus groups where people with LSE describe their symptoms, and these are actually quite striking in that some of the descriptions are descriptions such as the body feels paralyzed or foggy, headedness, or difficult to concentrate, listen, or speak. I think this is really important as we talk to our healthcare providers and to help them understand the level of fatigue that we're feeling, that we use these descriptors because our current language otherwise doesn't imply the severity of what people are going through. particularly that life is affected. So communicating how fatigue is affecting you is very important, not only to your healthcare providers, but also so family members can understand. Now, when you hear this type of fatigue, you may expect that fatigue would correlate with disease severity or activity, but in fact it is found that it does not necessarily correlate, and in fact can be present even when the disease is in remission. So this is often a kind of a puzzling nature of fatigue, and currently there's a lot of research going on to really discover the underlying cause of fatigue or causes of fatigue. So my next fact or fiction is X-fatigue is a symptom of other systematic disease processes or systemic disease processes. And in fact, this is true. Lupus is not the only disease process that has an issue with fatigue. That's why it's so concerning to the medical professionals. Fatigue is found in approximately 20% of the normal population, and is often linked to the symptoms of pain and depression. Other chronic disease processes have been known to have fatigue as well. Same type of X-fatigue I've described. In stroke, approximately 38 to 69% of people are found to have fatigue. Multiple sclerosis, the fatigue levels are also very high, 75 to 90%. Spinal cord injury, 57%. Even heart attack, about 48% experience chronic fatigue. Other systemic diseases such as Parkinson's, chronic obstructive pulmonary disease, transplants, have also found high levels of fatigue. So I think these are also areas that we can look to look at what's been effective for these populations, as well as really to understand the whole global nature of something that affects our whole body, and how this fatigue response may not be one disease process, but may be the severity of that process impacting our body and the way that our body responds. Okay, my next fact or fiction is fatigue is the most disabling symptom of lupus. Well, many would say yes. 65% of those with lupus report fatigue is the most bothersome symptom. 90% report it as problematic, and the predominant reason for not being able to participate in family activities. Fatigue certainly is one of the most first and most commonly identified physical symptom of lupus. From my own research on the needs of 96 Lupus Foundation members in 2009, I found that more than 80% of adults living with lupus reported symptoms of fatigue. What's interesting here is that greater than 50% reported fatigue at moderate to high levels. This is consistent with other research in the literature that shows very high levels of fatigue in the lupus population, perhaps any disease process. Fatigue is thought to be associated with many factors, including treatments, behavior activity, fitness, sleep, psychosocial status such as pain, anxiety, and depression, diet, and other associated disease processes such as fibromyalgia. Fibromyalgia is common in SLE. Approximately about 20% of patients also have that, which is also known to have chronic fatigue. In a recent study, 2013, in a literature review, they found fatigue, energy, depression, pain, helplessness, and inability to cope the top 5 issues in patients with SLE. In my study, I found that those living with lupus are very interested in community-based self-management programs. 68% of those out of 96 participants indicated interest in fatigue management programming. 58% in pain management, 56% in stress management, 55% in strength and conditioning, and 54% in life balance programming. What's interesting about this is, although there was this extreme interest, there's not a lot of available programming out there, which is why I picked this area to research and study. I could see that there was a huge need, but not a lot out there, as we will discover. My lights just went, hold on, I have to turn on my lights here.
We won't go anywhere, Brenda.
That's kind of funny. I'm in a room with a motion sensor, and I wasn't moving enough, and my legs went up. But my next fact and fiction was the question, all healthcare providers understand fatigue. I'm sure some of you have opinions on this. But basically, in some studies done on women with SLE, they reported that the psychosocial impact of the disease was not fully understood by healthcare providers. I think this is an important concept because a lot of times the disease management focuses on medication and maybe not looking at the holistic person and their whole needs. I think that's something as a healthcare system that we need to look a little more at. And organizations such as Lupus Foundation of Minnesota can be very helpful in addressing. Okay, I'm getting a little bit of feedback. Can you still hear me?
Yes, I can.
Okay. So recently, healthcare systems have begun to look specifically at fatigue and the need for the intervention. The reason for this is that people are understanding that in spite of good medical management, fatigue continues to limit performance and quality of life. So due to this impact on quality of life, fatigue is gaining recognition in the research community, and increasingly studies are looking for ways to accurately assess and looking at outcomes of different types of interventions for fatigue. So fatigue itself can be very difficult to understand and difficult to treat because of multiple factors that can be underlying it. And in fact, each person experiences it a little bit differently. The medical profession does not totally understand the pathophysiology of fatigue, although I had that as one of my goals for today. We do not really understand why it is as severe as it is with so many systemic disease processes. Fatigue can often, in current research, they're starting to break down fatigue, and they're breaking it down into having a cognitive dimension where, for example, you feel overwhelmed to the point of exhaustion, a physical dimension that includes muscle weakness, tension, pain, and an emotional dimension that includes a kind of a frustration and inability to do things. So my next fact or fiction is there can be a cycle to fatigue. And the answer to this is yes. If we think of lupus fatigue as fatigue from working too hard, we may think that decreasing activity is the key. Unfortunately, managing lupus fatigue by decreasing activity may lead to muscle weakness, decreased aerobic capacity. So if we decrease our activity, this can also feed into feelings of decreased inadequacy, which can lead to stress and fuels fatigue, and that is a fatigue cycle. There is strong evidence that pain and depression are strong predictors of fatigue and correlate to reduction in energy. When you look at this, there's some theories that link fatigue to mood disturbances and poor sleep. Poor sleep is associated with increased perception of pain and decreased ability to handle stress, resulting in increased anxiety, which again can fuel fatigue. On the flip side, click. Ability to self-manage and control symptoms and gain support and understanding may reduce feelings of helplessness and reduce fatigue. It can empower people with lupus with strategies to help control and manage and cope with the symptoms. Fatigue self-management programming is designed to educate in strategies and steps that help cope with the disease symptoms. Fatigue management programming can include topics such as joint protection, medication management, disease process, exercise, how to conserve energy, communication, goal setting, stress management, and sleep hygiene, which is strategies to improve sleep. These are designed to increase coping skills and improve self-efficacy. Self-efficacy is a term that's used to describe a person's belief in his or her ability and capacity to accomplish a task or deal with the challenges of life. Okay, next, fact or fiction. Nothing can be done about fatigue. This is one of my biggest slides, and I have to find my right thing. But what do you think it is? Actually, there are a ton of things that can be done for fatigue. Even non-pharmacological intervention, which is the basis of fatigue management programming. In a systemic review, which is a review of many studies on non-pharmacologic interventions for MS, rheumatoid arthritis, and lupus, they found low-impact aerobic exercise, behavioral, nutritional, and psychosocial interventions were associated with significant reductions in fatigue levels. Community-based self-management programs have been advocated for those with arthritis-related disease to protect joints, maintain health, and promote safe physical activities. This type of small group, community-based programming is normally done in a 6-week, 2-hour per week format. It has been found to be effective in both face-to-face and online formats. One example of a community-based self-management program is the Arthritis Foundation Self-Help Program. This program provides education on stress management, medication use, exercise, and coping strategies. It has been found to decrease pain by about 20% and also decreased physician visits for up to 4 years after the course participation. Another example of an effective community-based education program is the Chronic Disease Self-Management Program. This is specifically designed to assist in the management of chronic disease processes, including exercise, use of medications, communications again, how to work with health professionals, nutrition, and ability to evaluate new treatments. This particular program was designed for people with arthritis, stroke, lung, and heart disease. People who took this program reported significant improvements in exercise, communication, self-reported general health, health distress, fatigue, disability, and social role activities. This particular program, the Chronic Disease Self-Management Program, was piloted in 2012 with 49 people, actually African-American women with SLE, and they also confirmed that the program was effective in reducing physical symptoms, increasing self-management, and reducing healthcare utilization following program participation. Now, this concept of fatigue management programming actually started by the work of Packer, Brink, and Sorrell in 1995, who developed a course titled Managing Fatigue, a 6-week course for energy conservation. Click. Studies with those with multiple sclerosis were done by Mathewis and Matuska, two local researchers, that showed that energy conservation programs can be effective in reducing physical fatigue, mental fatigue, and decreasing stress levels. They also looked at the same group of the same population 1 year afterwards and found that participants were carrying over the strategies, the energy conservation strategies, into their daily life, such as changing body positions, using rest periods during longer activities, changing the location or arrangement of supplies, and resting during the day. My work on development of the fatigue management program for SLE was based on this multiple sclerosis research, but the program was customized to the specific needs of those living with SLE. I added in components of joint protection and exercise. So far, 36 Lupus Foundation members have participated in the pilot Get Up and Go fatigue management program. 16 Masters of Occupational Therapy students have been trained as facilitators. My preliminary results indicate that 3 months post-participation in the program, fatigue is reduced. In my conversations with participants, they are continuing to employ the strategies even up to 2 or 3 years later. My results are similar to the results of Sonig in 2003, who studied those with SLE participation in the Systemic Lupus Erythematosus Self-Help Program. They also found improvement in fatigue, coping skills, self-efficacy, and depression. It's important to note that all these programs were reported to reduce fatigue, but did not change pain or disease activity. The next fact and fiction. Fatigue is caused by the disease process. My answer to this, maybe. As all of you know, lupus is a very complex disease process. One of my favorite authors, Daniel Wallace, who wrote the Lupus book and is now on his 5th edition, a guide for patients and their families, states if you know lupus, you know medicine, because the complexity and it touches every aspect of the body. So in fact, lupus is associated with anemia, decreased red blood cells, and active inflammation, which have both been shown to increase symptoms of fatigue. The term primary fatigue is used to indicate symptoms that are caused by the disease process, and these conditions that I've mentioned, such as anemia, infection, hypothyroidism, fibromyalgia. There is also some evidence, and actually a lot of research going on into cytokinin dysfunction that's associated with lupus process. This is found to be a dysfunction in lupus, and that can build up particularly with inactivity. So keeping active yet pacing activity helps prevent the buildup of cytokines, or in theory, or that's the theory behind the cytokine relationship to fatigue. Now for primary fatigue, you may be able to work with your doctor on reversible causes of fatigue through your medical management of anemia or the lupus FAIR. The theory that links fatigue to the disease process and the pathophysiological methods is supported by the observation that fatigue increases during flares, but this cannot explain, beyond the time of flare, why this type of fatigue continues to be found, or why it is also found in non-inflammatory disease processes. Now I placed this slide in here with the CLAT looking at the book to just give a full appreciation of the complexity of the defense system that's involved in the process of lupus. Now, the inflammatory response system is designed to protect our body from threats and defriend us. It is a very complex system. The defense system consists of blood and tissue systems within the body, as well as hormone signals. Red and white blood cells produced in the bone marrow and migrate between blood and the tissue. Red blood cells carry oxygen to the tissues. If you have low red blood cell count, you may be suffering from anemia. White blood cells are called leukocytes, and they are the primary defenders that control our immune response. Other blood components include platelets, which can clot our blood, and plasma. Plasma makes up most of our blood volume and contains proteins and other substances that are being carried throughout the body. There are 5 types of white blood cells, or leukocytes, and each have a role in defending the body from illness through activating our defense systems. The neutrophils and the granulocytes arrive early in the inflammatory process to prevent infection and eliminate perceived foreign substance. Neutrophils turn on the system, generating chemicals such as histamine and prostaglandins to promote inflammation. Eosinophils, which are active in allergic responses, and basophils, which protect the body from fungal and parasitic invasion. Monocytes, which recognize and dispose of foreign materials or antigens through activation of macrophages. In lupus, the 5th type of white blood cell are the lymphocytes. They are important in regulating the defense system. There are 3 types of lymphocytes: T cells, B cells, and natural killer cells. Lymphocytes are made in the thalamus are called T cells. Lymphocytes made in the bursa are called B cells. Now you're getting the idea that this is all pretty complex. And I think when we think about fatigue and we think about the body, we can appreciate the complexity of our body, what a wonderful organism it is, but how there's a lot of things that we do not understand. Now in lupus, the T cells are often involved. There are 2 types of T cells, a T helper cell and a T suppressor cell. During the inflammatory response, T helper cells trigger the liver to make chemicals that increase inflammation and promote growth factors and produce more white blood cells, ramping up the immune system for defense for a perceived invader, responding as if, well, in lupus, sometimes responding even if there is no invader, but that there's a perceived one. The T suppressor cell has the opposite effect, suppressing the immune response. In lupus, the T helper cells become more active than the T suppressor cells. I'm getting a lot of feedback. I don't know if you can hear that or not.
I'm not hearing that. With other people.
Okay, then I'll continue. Okay. So cytokines in this case are hormones that are activated that signal or alarms the body to what type and how much defense is needed. Cytokines are interleukin and interferon that play a role in the growth and the development of cells ramping up and ramping down. In lupus, the cytokines function is altered, increasing that inflammatory response. As I've mentioned before, cytokines can build up with inactivity. The fact that cytokines can be reduced by movement is one of the primary reasons why physical activity is thought to maybe help reduce fatigue. In lupus, the B cells are signaled to make antibodies to their own tissues called autoantibodies. Autoantibodies can be a marker for lupus and are commonly tested. Now, a small number of T cells act as memory cells for our immune system. So, in fact, if they come across the same trigger again, it'll alert the body again. So this is also a factor in lupus. Now, this is a very brief overview, but I think it's important to reflect on the complexity of the system and why it may be so hard to really truly understand what is going on with lupus, as well as its relationship to fatigue. One of the things that we do understand is the lymph system. The lymph system is a key part of the immune system. It basically is our garbage disposal systems. It's what we know of when we think of our lymph nodes, and vessels actually carrying lymph fluid back to the nodes. We know from research on cancer that movement helps lymph flow and helps get rid of inflammation. This is another reason why active movement may be helpful in reducing the inflammatory response. The lymph system is operated by our muscles, which our muscles create the pump to move the fluid. So muscle activity is an important part of the lymphatic system. Now this area is almost just as complex. Fatigue, fact or fiction. Fatigue is caused by medication. Well, in fact, yes, fatigue can be caused by some medications, but the good thing is that many lupus medications reduce fatigue, particularly the corticosteroids and the antimalarial medications. Now, your doctor may prescribe other medications, such as antidepressants or medications for pain. My big message here is to really look at the type of medications that you're taking and the side effects, as well as journal so that you understand how the medication is affecting your fatigue levels. It is important to work with your healthcare provider, helping them to understand how these particular medicines are responding with your particular body. We don't all respond the same. Communicating with your healthcare team can help maintain the optimal treatment for you. Click. Okay. My next fact or fiction. Fatigue is caused by secondary symptoms. Well, the answer to this is yes, fatigue can be caused by secondary symptoms. Secondary symptoms are things such as pain and depression or muscle weakness that are related to the disease process but can be altered with lifestyle changes. The secondary symptoms are what we look at particularly when we're designing a fatigue management program. We're looking at strategies to reduce these secondary effects. Fatigue management programming takes into account education for behavior change. In self-management programming to improve nutrition, exercise, sleep, rest cycles, and daily task planning to conserve energy and reduce these secondary effects that can cause fatigue. So secondary causes that can cause fatigue are muscle weakness, joint imbalance, pain, heat and light sensitivity, poor nutrition, difficulty with sleep, depression, anxiety, stress, and pain. Now I'll look at these individual components that are part of fatigue management programming. Muscle weakness and decreased aerobic capacity is greater in those living with SLE than secondary controls. Decreased aerobic activity or deconditioning has been associated with increased fatigue and poor quality of sleep. Both aerobic activity, range of motion, and strengthening have been shown to decrease fatigue for those living with SLE. SLE patients can improve aerobic capacity and exercise tolerance. Studies show at least up to 18% in through aerobic exercise programs. Even in children with inflammatory diseases, it's been shown to report benefits of increased range of motion, muscle strength, and function with no adverse effects to exercise. That said, I believe that exercise needs to be done very carefully and very individually. Our program is designed to help people assess their own abilities and limitations, particularly in the area of muscle weakness. It's important to use muscle efficiently and in the mid-range rather than in stretched or shortened positions. 60% of those living with lupus report muscle pain or myalgia. It is often reported in the neck, upper and lower back. General conditioning programs such as walking, biking, and swimming increase the oxygen to the tissues and reduce inflammation. Muscle strengthening can also be utilized to protect joints that are often involved in lupus. Learning to use muscles to stabilize a joint can also reduce pain and inflammation. An optimal program would allow strengthening to improve muscle tone and balance and stabilize joints. What's important to note here is that muscles protect joints. Oftentimes, muscle spasms or tenderness is due to the muscle trying to protect an injured joint. So addressing concerns of muscle tension can also be effective in reducing pain associated with muscle involvement. Activity modification can also be used to reduce and rethink muscle use during home activities and work activities. An example of this would be modifying a work task to use a stool rather than stand. When inflammation is present, it's important to adjust and reduce activity in response to a flare. This is also true of muscle activity. Learning to read our body and adjust our programs so that they work best for you is also part of fatigue management programming. Learning to set appropriate goals, what works in your life and your family, is taken into consideration. Many of the studies that have been done on physical exercise are small, but in general show that exercise improves symptoms of SLE. Particularly, cycling programs have been shown to reduce fatigue and increase energy, as well as increase a sense of well-being. Aerobic exercise has been found to improve well-being as well and reduce depression. Walking programs have similar benefits.
Brenda, is this a good time to ask a question? Several from the audience.
Sure. Sure.
What is meant by heat and or light sensitivity?
This is regards to in lupus. People are very susceptible to UV rays, and so exposure to outside sunlight or certain types of even indoor lighting could cause a inflammatory response. So part of the programming that I developed for fatigue management is learning about how to avoid those types of situations or protect it through, for example, UV filtering clothing or appropriate sunscreens. The advantage of a small group format is it allows the members to share strategies that they found to be effective. So for example, in the idea of a sunscreen, I've had people share ones that really work and ones that really don't work. So those are important tips as far as the sharing, group sharing that can occur in a fatigue management program.
Thank you. Another question. NSAIDs and anti-malarials cause fatigue, or do they prevent it?
In general, I would say they prevent it, but I think that we need to really, as far as medication goes, I'm not one that prescribes medication, but what I normally advocate is to really track your response, because sometimes medications, what is helpful for one is not helpful for another. So I normally recommend journaling and tracking. But because most of the medications for lupus are designed towards reducing the primary symptoms of fatigue, they are generally thought to be favorable.
Thank you, and I've advanced to your next slide.
Okay. Now, 80 to 90% of those with lupus have joint pain. In lupus, joint pain involves the synovial joints, particularly the hands, the wrists, the feet, but also can involve the shoulders, knees, ankles, and jaw. Joint pain tends to be worse in the morning and improve throughout the day. Many people with lupus also have joint-associated conditions such as arthritis. Now, what's really important to think about is joints are very highly innervated. This is why arthritis are associated with such extreme pain. It is also why I include joint protection or ways to stabilize the joint and prevent excess stress to the joint in self-management programming. With lupus, the synovial fluid within the joint becomes thickened due to the immune response. The thickened synovium can increase pain but also increase joint instability. So concepts that really stabilize the joint and protect it during use can help reduce pain. This is an area I would personally like to do more research on, because personally I've found that this area is one of the areas that our program participants have really felt that is very helpful for them, using adaptive equipment when needed, using ergonomic strategies, and modifying activities to reduce stress on joints. This comes into play even when doing exercise, because a lot of times exercise positions are putting joints in places of stress. And this is one thing that we want to avoid. So teaching people how to modify activities and use of their joints to place them in very stable positions, to use muscles, can be very helpful and protective for the joint. Now, why this may not be thought of as directly related to fatigue, I think bone loss is very important to address. Matter of fact, it is found that the self-reported fracture rate in those with SLE is 5 times the normal population rate. When you have a surgery or have a fracture, this is going to inflame your inflammatory response and aggravate symptoms of lupus. So it's protective to talk about weight-bearing programs to increase bone density. Also, 40 minutes of light exercise has been shown to be protective against bone mineral loss, done about 4 to 5 times per week. This is also where calcium supplements and vitamin D type of diets come in to help prevent osteoporosis.
Brenda, I wanted to give you a heads up. You've got about 15 minutes left.
Sounds great. I think we're right on time.
Excellent.
Okay. So another area that we typically address is restful sleep. Sleeplessness can cause both mental and physical fatigue. Not getting enough good night's sleep zaps your energy. Lack of restorative sleep will result in, or can result in, increased perception of pain and increased perception of stress. Medication can help with this, but also we tend to, what I tend to be more involved with is something called sleep hygiene. Sleep hygiene is a concept of looking at normal routines for sleep, things like regular bedtimes, reducing stimulation prior to sleep, using relaxation such as heat or a bath or meditation prior to sleep can help calm the system and increase the ability to fall asleep and rest. So this is one of the areas that we address in fatigue management programming. In the studies with multiple sclerosis, adding rest breaks was one of the most important things that the participants felt was important long-term in their ability to handle fatigue. So learning to think and plan about how we are using our energy can also be helpful. Another correlation, I hate to keep coming back to exercise, but there is a correlation between exercise and improved sleep patterns that's reflective of the relationship between sleep and exercise in the normal population. Within the fatigue management program, we try to balance work, rest, and assist actually I want to add family in there. There's something called life balance that we also talk about, looking at how to balance our normal day, to put in the priorities for us. Lupus can be an all-encompassing disease process, and how to figure out to maintain the values that we have in our normal daily life is often something that we have to do on a cognitive level to make sure that we don't forget the things that are really most important to us. So helpful strategies are planning, resting, and some home modification, oftentimes delegation, as well as being able to talk to family members about the stressors that we have. Stress management and pain management are actually something I'm going to be looking further into this coming fall. I hope to offer another 6-week program this fall through the Lupus Foundation on stress management and pain management. These are often interrelated and often associated with fatigue. Psychosocial interventions have been shown to reduce anxiety, depression, and stress. They have not always correlated with fatigue, however, or physical health. Our emotions are very complex and do affect our body responses. While stress has not been shown to cause lupus, it has been correlated with lupus flares. Stress can trigger your autonomic nervous system, which releases cytokines signaling or triggering the inflammatory response. These cytokine proteins have been associated with fatigue. Part of the stress management program is learning how to set goals, as well as trying out different types of stress management techniques, such as meditation, different forms of meditation, different forms of relaxation, to find what would work for you. My lights just went off. I'll be right back. Okay. The last area I want to address is the cognitive fog. Go ahead, advance. Yes. We do address this as well. Oftentimes our participants mention that difficulty thinking and strategies that can be used to maintain their thoughts, such as taking notes or memory aids. Our participants have found this very helpful in looking at technology, particularly apps that can be helpful. We are in a very exciting age that allows us to explore teleconferencing apps, look at all the fitness apps that are out there. There's so much technology that we can use that can help reinforce home programming and follow through. Some examples that we could talk about would be the use of Google Calendar that can send us emails, use of technology to manage some of the memory tasks and reduce cognitive demands. Okay.
Brenda, is this a good time to ask questions?
Well, actually, why don't we just go to the last slide, because I'm on the last one. That will be perfect. So this is a great time for questions, because you kind of see I have a kind of a mixed bag, or a mixed arm of cats, if you want to say it that way, that there's many different things or ways that we can address fatigue. They're all, maybe all little pieces, but in together they can be helpful, and research has shown that. I'll take the questions now.
Thank you. One person asks, what type of professional might I see to assist me in helping design a program? I experience significant muscle tightness throughout and joint pain and swelling in my hands.
This is a great question. My background is a hand therapist. I think for people with lupus, it's very important that they find somebody who understands the disease process. That's part of the reason why I've been teaching this content in our curriculum, is to get more professionals out there that really understand the disease process and address, look at it more than just handing out, say, therapy. Really, I would contact a clinic and ask for who, if they have somebody who specializes in inflammatory disease processes. There are certified hand therapists. I work for Fairview Hand Center, and there are therapists within Fairview Hand Center that do specialize in inflammatory disease process.
Thank you. Another question. What types of inflammatory responses result from sun exposure? Are light blotches in the skin one way?
That is true, but I believe it also can cause inflammation within the whole body system. So it's not, if you think of it on a cellular level, yes, you have skin that's responding in an inflammatory way. That's where the lymph system is, but it can trigger the whole inflammatory response. So that's why we talk so much about protection of exposure to light rays.
Thank you. And the last question. Sounds like there's a high level of interest in the community for community-based self-management or fatigue from pain, stress, and other conditions, but there also seems to be a gap in what's available. I'm curious about the use of the practice of yoga, meditation, and other mind-body options at local wellness centers as possible options.
You're bringing up some excellent questions. I believe there are a place for many things in the management of lupus. Yoga is one of them, but it has to be done with an understanding of the SLE process in your particular condition. So we do talk about that in my physical activity course and the lupus management course on what some things that you should really watch out for. I think if in the general public there's great resources available. I think working with them to really have them understand your symptoms, understand how to protect your joints, and still do the programming is key to a successful program.
Thank you. We do have time for one more, and there is one more question. What are a few barriers to managing fatigue?
Well, one is we don't understand it fully. So when I talk about fatigue, we're talking about multiple things. We're talking about physical, we're talking about emotional. So it has all these different dimensions to it. So that's a barrier. There's no one thing that you can really look at. Another barrier, I think, is the sustainability of offering something like a fatigue management programming. In my mind, I think everybody with lupus should be given the opportunity to attend these, either through teleconference or through face-to-face sessions throughout the nation. But yet, community-based programs tend to be fairly underserved, unrecognized, and fairly unreimbursed within our healthcare system. So our healthcare system has actually been a barrier. The nice thing is that on the horizon, there's a lot more energy right now looking at preventative care, and prevention is where we need to look at these programs. So I think in the future, we're going to have more support for this type of programming and more of it offered.
Thank you. We just got another question that rolled in, if you wouldn't mind, in the last 3 minutes. Do you have any advice for a recently diagnosed college student and how to deal with the stress and increased fatigue it causes?
Okay, Kathy, number one, I recommend utilizing your counseling service within your college. I am currently in a doctoral program for higher ed administration, so I'm very well aware of the increased stress and anxiety that comes with college, especially first year, and that can certainly cause flares. I believe getting psychosocial help as well as linking to programs such as Lupus Foundation. They have some excellent programs that we have coming up that address many of these needs, can help give you or put in place the supports that you're going to need to be successful.
Well, we've come to the conclusion of our webinar. I want to thank you very much, Brenda, for your presentation on fatigue management. Appreciate your expertise in the area and the information that you provided to all of us. Thank you so much. As you continue to advocate for people who are living with lupus. Thank you.
Also, I have one more.
Oh, yes.
Can I mention one more thing? Next month, Ariana Tome, one of my students, is going to present on occupational therapy interventions for those with lupus. And also, if you're interested in any of the programs that we've developed, fatigue management, the extra physical activity program, or stress management program, please let Sandy know, and we'll put your name on a list of people that might be potentially interested in attending.
Terrific. I want to thank everybody for joining us today for the webinar. If you'd like a certificate of attendance, please email me at sparnell@lupusmn.org. And if you would like a copy of the PowerPoint, please do so as well. Thank you very much. Goodbye.